My name is Susan Murphy. I'm a clinical specialist physiotherapist at University Hospital Waterford, and I have a PhD in the management of low back pain. For someone with persistent pain, we would recommend exercise. Often people with pain tend to neglect exercise and have fear of making the problem worse, but it's very important to maintain regular exercise to keep their function. When you have persistent pain, it's very important that you understand it. Pacing is extremely important, where you pace your activity levels, because you may not be able to do things at the level that you previously did. Also, there are lots of supports out there, and getting advice from a chartered physiotherapist with regard to exercise is important. Quite often people who have persistent pain are less inclined to exercise because they have a fear of making the problem worse. However, exercise helps people with persistent pain. We would encourage aerobic exercise in the form of walking, swimming or cycling, as this helps to maintain your conditioning and enhance your function and quality of life. In addition, we would recommend specific exercises that help to maintain the strength and mobility of your body. This first exercise is a movement exercise for your lower back. Lying on your back with your knees bent, gently pull both legs towards your chest. You will feel a stretch in your lower back. Hold this position for 10 seconds and repeat 3 times. This helps to move and stretch your back in order to maintain mobility. This next exercise helps your spinal flexibility. Again, lying on your back with your knees bent. Stretch your arm out at shoulder height level, resting on the ground. Turn your head to look at your hand. Roll your knees in the opposite direction, aiming to get your knees to touch the floor. Hold this position for 20 seconds and repeat once on each side. This stretches the muscles of your lower back to maintain your flexibility and release tension. This exercise helps your core muscles and also encourages movement of the spine. Gently roll your spine off the ground to form a bridge. Hold for 10 seconds and then gently roll your spine back to the floor. Repeat this exercise 3 times. This exercise is a really nice stretch for your whole back. Sitting on your heels, stretch your arms forward as far as possible. Your aim here is to get your forehead to touch the ground, feeling a good stretch in your entire back. Hold this position for 30 seconds and repeat the exercise twice. For people who have persistent pain, don't suffer in silence. Contact your GP for general advice and direction. Also, you can contact a chartered physiotherapist who will give you specific advice with regard to exercise. And you can also go to the website mypainfeelslike.ie and complete the questionnaire.